आपने मेल किया है वो वाला।
Good afternoon, Saman.
Hello, good afternoon.
Good to see you.
Good to hear your voice.
I was looking forward, at least I'll get through this internet technology, I'll at least get to see someone and say hi to him.
Yes, yes.
I haven't had a chance to meet you for quite some time. It was nearly every year we used to meet. That has been quite some time. We'll have to make some sort of excuse to meet. As a matter of fact, one of my students has actually just sent you a paper in your journal.
All right. Yes. We are at the moment resting. Yes.
Excellent.
Yes.
So I was told that please speak to someone. Of course, I'll be speaking to him. I'm looking forward to it. And also that we have been fairly busy at work with your support and God's grace regarding smokeless tobacco. Some progress is being made.
Very good, very good. Yeah.
And we're also trying to get Sri Lanka. I spoke to all the right people, including Tilak and the folks from Lata.
Yeah, I'll be in a minute.
Okay.
Yeah. So we have a couple of minutes to go.
A couple of minutes. I was just getting ready to introduce you guys.
Yeah.
So, it is a long introduction. I'll probably cut it short so that you guys get more time to speak, both Amit and you.
Thank you.
So you've been well?
Yeah, very good. Yes. Are you going to Kuala Lumpur?
Yeah, yes, I am.
Yeah. I won't be there, but
I am going to miss you. I was really looking forward to it, but we'll do something maybe in the next few months. Hopefully, we'll make amends. Either I'll come to London or I'll call you here.
Thank you.
Also, we are looking at a possible meeting in Sri Lanka. If possible, we'll get you there. I'm not sure when we are going to handle it. There's a lot of international travel in the next few weeks. But let us see. You don't have any specific plans for Sri Lanka, do you?
No.
Okay. Let me see if I can coax these guys to sort of fix up a time which we can all meet together. I'm trying to get Dr. Prakash Gupta as well as Dr. Sinha also to be there.
Yes.
Let us see how it all works, if at all. Apparently, there's one more meeting on oral pre-malignant lesions in Bombay sometime in December. Unfortunately, I am also out of town at that time. I won't be able to attend. I know that is something which is very close to your heart.
Yes, absolutely.
Okay, are we on time?
Yes.
4:30. Can you start? Yeah.
So, who is going to move my slide, Amit?
Yeah, I'll do it from here.
Okay, right. Thank you. Apple can
Yes. You join in as we. Okay. Because it's just 31. People take their time, 31 to calling the ID. Yes.
All right. Well, I think we should start the introduction. Okay. Good evening from India. We, on behalf of the HCPC WHO Global Hub for Smokeless Tobacco Information, welcome to the 4th seminar of the series. And today's topic is education, training, public awareness, and communication on smokeless tobacco products. Today, we have a very eminent speakers. We have Professor Saman Warnakulasuriya from the UK and Dr. Amit Yadav from ICMR in India. Today, I will briefly talk about speakers. Dr. Saman is an emeritus professor of oral medicine and experimental pathology at the King's College in London. And I think many of the people who are working in tobacco and oral lesions know him very well. He has been the chair in oral medicine and experimental pathology at the King's College for the last many years. And he also directs the WHO Collaborating Center for Oral Cancer and Pre-Cancers. He has been expert at the WHO working groups from the IARC in Lyon, as well as the EU Scientific Committee on Evaluation of Carcinogenic Substances. He's the editor-in-chief of Translational Research in Oral Oncology, which is a relatively new journal, but I believe it is picking up speed very rapidly. He is a recipient of many awards, including the Distinguished Scientific Award for his research achievements from the IADR, that is International Association for Dental Research. And the Queen, Her Majesty the Queen, has honored him with the Officer of the Order of the British Empire, the OBE, which is not too many people in the field of medicine get that. The next speaker we have is from our own institute here at the WHO Hub, Dr. Amit Yadav. He is a PhD in Public Health Law and Tobacco from the National Law University at Bangalore. He's also done his leadership program on tobacco from Johns Hopkins Institute, School of Public Health in Baltimore. He has a numerous number of research publications in public health, law, policy, and advocacy, as well as legal and policy research and analysis in the field of tobacco control and non-communicable diseases. He has worked earlier in various tobacco organizations, including Hriday and PHFI. Now he works as a coordinator of our efforts in tobacco control in high-burden areas in this country. I'm also happy to tell you that this activity, the webinar series, is funded by a grant provided by the government of Norway through the Secretariat of the FCTC and the government of India. So without further ado, I will invite Professor Saman Warnakulasuriya for his talk, and followed by Dr. Amit Yadav.
Thank you very much, Ravi. Good afternoon, everybody. Greetings from London. Can you hear me?
Yes.
Yeah, okay. So greetings from London. Thank you for joining. It is a great pleasure to join the webinar series conducted by the FCTC Smokeless Tobacco Hub. And as Ravi mentioned, this is the fourth in the series of the Smokeless Tobacco webinars and conducted by the Smokeless Tobacco Hub. My name is Professor Saman Warnakulasuriya. As Ravi introduced, I'm the professor at King's College London on experimental pathology. Next slide, please. So this particular inauguration of the webinar series was made by the FCTC Global Knowledge Hub on Smokeless Tobacco to introduce our efforts to control smokeless tobacco use in the region. Next slide, please. And as you know, the WHO FCTC initiative was a landmark in public health, and the Article 12, which we based this webinar series, this particular seminar on, introduces the importance of education, communication, training, and public awareness. The objective is to provide an infrastructure for raising public awareness in the region and in member countries and in global aspects, and running effective education, communication, and training programs to the partners of the FCTC. Next, please. And this reflects on the webinar series itself, because the objective of the webinar series is aimed at raising awareness on matters related to smokeless tobacco use and control to scale up interventions to control smokeless tobacco. Next, please. So I'm going to speak about education and training, and my co-speaker Amit will carry on the other aspects of the seminar. It is important to recognize that smokeless tobacco causes cancers of the oral cavity, esophagus, and pancreas, and many other harmful effects are known. These are well described in the monograph published by the IARC on smokeless tobacco, having evaluated the significant health risks. So reflecting on education and training, I'm very keen to make sure that medical and dental curricula have sufficient amount of modules on tobacco, and in our region, in South Asia, particularly on smokeless tobacco. And I will add on this the necessity of training medical and dental students on this topic during their undergraduate years. We need to continue this to continuing professional education to doctors and dentists, as well as allied health professionals, particularly pharmacists, because many tobacco users will end up in the pharmacy asking for over-the-counter prescriptions, and they have opportunities to educate people on harms of smokeless tobacco use. We need to extend the programs to school teachers and adolescents, and I will show you some examples of efforts made in that sector, as well as special groups. And examples of these are customs and excise officers who have a responsibility to control movement of smokeless tobacco from one country to another at the ports. And also we need to educate the traders on the harms of smokeless tobacco, particularly selling these products to young children. Next, please. So speaking on medical and dental curricula, I think research which has been done on the educational curricula have consistently reported that schools only provide very basic knowledge to their undergraduate students, and that we lack any intensive behavioral components to train professionals on tobacco issues. This has come out of many of the research projects, and I'm going to show you one example, next please, of a project. Next slide, please. This is a survey which we did on tobacco education among European dental schools. 68 dental schools in Europe participated in this particular survey from 21 European countries. And what we demonstrated was that only 10% of the schools which responded said that they use a specific history form to record tobacco use of patients. Although medical aspects are recorded, tobacco use is not in these medical records. And only 16% of the schools provided brief counseling to patients through dental students. And this is the only way we can train students if we start it at the undergraduate level. Next, please. So limited training of dental students is reflected in the practicing dental professionals' inability to offer tobacco interventions. And many of the surveys done among dental practitioners, answer often given is that we have not been trained sufficiently to provide interventions on tobacco use to patients. So this is important to understand the gaps in the education, and most of the audience perhaps have responsibilities in educating students. And I would encourage you to speak to the deans of schools to introduce tobacco education in the curricula. In order to help this process, we published this article in the International Dental Journal on the various aspects which need to be included in an educational program in the curriculum. Next, please. And in that article, we refer to 3 levels of training. The basic care and the intermediate care can be taught at the undergraduate level, and advanced care and referring patients for specific tobacco cessation in the postgraduate education, continuing education programs. Next, please. So the educational modules which are required should cover 2 aspects. The knowledge aspect, which is shown here. There are 5 topics at least on the knowledge aspect: basic biological effects of tobacco use, genetic predisposition of nicotine dependence, tobacco culture and policy in the country, psychological aspects of tobacco use, and awareness of target groups, the special groups like low-income groups and pregnant females and adolescents. And then there should be a component of the skills training, which should be done in the clinical training of a student. Next, please. And this should be followed with assessments throughout the course, as well as end-of-term assessments, in order to make sure that the students have taken into consideration incorporating tobacco cessation at every level in their clinical training. Next, please. So, moving from undergraduate curricula to continuing professional education to doctors and dentists, there are many ways in which we can pass through this knowledge, courses and seminars. For example, last year at the World Congress in Preventive Dentistry held in New Delhi, we had a seminar on tobacco kills, and smokeless tobacco was highlighted in that seminar. We had 450 participants gathered at that IADR seminar on World Preventive Dentistry. Of course, journal publications have to continue, and we support publications from Southeast Asia in imparting this knowledge to doctors and dentists. And one other aspect I'm going to talk about is web-based learning, which is now gaining momentum in terms of training doctors and dentists. So this is a publication which you can download, Oral Health Risks of Tobacco Use and Effects of Cessation. It speaks of all forms of tobacco, including smokeless tobacco. And the next one, which is based on smokeless tobacco, will be in print very soon. It's in the Indian Journal of Medical Research. Next one, please. Indian Journal of Medical Research. And this series is edited by Ravi himself. And I have written the publication on oral health consequences of smoking tobacco use with Aravind from right. So in terms of web-based learning, we have produced several programs, and most of these relate to smoking cigarettes, but it's important to have more web-based learning programs on smokeless tobacco. So these are 2 programs. One is called Tobacco Oral Health Net, specifically for European dentists, and this more recent one also for oral health professionals on tobacco use prevention and cessation. Next slide. We ran an e-learning project on smokeless tobacco cessation, which is now available free of charge. It was sponsored by the European Union, and it gives ways of interventions which can be done in dental and medical practices. Next, please. So what we teach to practitioners is to run brief interventions every opportunity when they have a patient. The model which we teach is the 5A model, which is ask, advise, assess, assist, and arrange. And these 5 A's need to be promoted in any brief intervention model. You could download from our website each component of these 5 A's so that the practitioners could learn the policy behind tobacco intervention. And it only takes about 3 to 5 minutes to run through these 5 A's in a busy practice. Next, please. So moving on to what has been done, here is an example of a program which is run in India for young dental professionals. This is run by Professor Vinay Hazari from Nagpur. It's based on the Johns Hopkins Global Tobacco Control modules, and it's an online program. And you, if you participate in this as a young professional, you get an online certification. You can see Vinay in the center here. And these young professionals who have gone through the program receive an online certificate which they can display in their practice after completion of the course. So this is a way of getting them on board in terms of tobacco cessation. Next, please. And the modules include many aspects of tobacco control, from the WHO policies to legislation and tobacco cessation training. And eventually they go on field assignments for community awareness before they receive this online certification from Johns Hopkins Global Tobacco Control Program. So this is something which can be adapted in many parts of South Asia because it's free. You can get it from the center. Thank you. Next slide, please. I have produced a video for pharmacists. So this is another way of educating people who are involved in healthcare aspects. And the pharmacists have opportunities to talk about tobacco cessation, smokeless tobacco cessation, whenever a patient comes to a pharmacy to obtain any over-the-counter medications. Next, please. Moving on to other sectors, school teachers and adolescents, because these habits start very young, and we must use the school teachers as a way of snowballing this message to students in all schools. And I'm pleased to note that in Tamil Nadu, there was a program through the Mary Ann Charity Trust in which they were provided art drawings which were displayed in schools to educate kids on ill effects of tobacco. Next, please. Another aspect is explaining to the vendors who sell smokeless tobacco the dangers of the product they are selling. And Professor Vinay Hazari from Nagpur again has been doing this in his city, in Nagpur. Next slide, please. Next slide. So here he is going to various vendors in Nagpur city, educating the vendors about smokeless tobacco products, what regulations are available, and the safety of these, the selling in terms of prohibitions, etc. Next, please. And in Sri Lanka, there has been a way of also educating vendors. They refer to the Gazette notification. Tahanam means prohibition. And this has gone on in public places to explain to the public that the smokeless tobacco should not be sold and that the vendors should understand the court cases they can face if they sell smokeless tobacco in their shops and boutiques. Next, please. And this program is run by Dr. Hemant Amarasinghe, who is spearheading this program, which we call a social marketing campaign in Sri Lanka on awareness of dangers of smokeless tobacco and arecanut. And he has done through various sectors. An interesting aspect is the advocacy programs he has run through various religious leaders, because that is a point of contact for many rural villages, and they could be educated through the various religious sectors. Next, please. So here he is. Sorry, before that, quite a lot of print material has gone, leaflets, posters, stickers, and also focused TV spots on dangers of both arecanut and smokeless tobacco use for educating the public. Next, please. So here is Hemanta's program of educating religious leaders in the country. And this is our president himself, who was involved when he was the health minister, what we call the betel tray education, where we have removed the tobacco and arecanut from the betel tray. And this is Hemanta, who is running that program in Sri Lanka. Next, please. So in summary, in conclusion, most users unfortunately are still unaware of the dangers of smokeless tobacco use and we need to focus our efforts on education and training and facilitating the cessation of smokeless tobacco use. And my colleague Amit will run through various other programs which have been done mostly in India and neighboring countries to explain what we can do in the future in all countries to combat the problem of smokeless tobacco. Thank you. And I wish to thank several people at the FCTC Club, particularly Kumar Chandran and Ishka, for helping us to set up the web program. Thank you.
Thank you, Professor Saman. Now I would like to talk about the progress made by various countries. Let me share my slides. Okay, I'm going to talk about the education, communication, training, and public awareness on SLT. And this is there an echo? Okay, can I? Let me. Is there an echo? No. Okay. Yeah, so I'm going to talk about the education, communication, and training public awareness that the FCTC parties have implemented and how it has been recorded and what has been done till now. At the Knowledge Hub, we have tried to document the progress made so far in this Article 12, which directs about education, communication, and training regarding smokeless tobacco and generally tobacco. So if you look at the Framework Convention, so Article 4 itself talks about, people should be informed about the health consequences, addictive nature, and the threats posed by tobacco. And this obligation has been, so to meet this obligation to inform, there is an active obligation of our parties under Article 12, which says that parties should promote and strengthen public awareness of tobacco control issues, and so through all means possible. Based on this, Article 12 guidelines were adopted, and parties agreed to, in terms of, and identified that there's need to establish an infrastructure, build capacity, promote social change through international collaboration, and ensure that education, communication, training programs include a wide range of information tobacco industry strategies and the products. So how this has been fared, so how parties have ensured that this is met. So if you look at the parties' progress, so what we see is 125 parties implemented these provisions for smoking tobacco, while this was done only by 70 parties for smokeless tobacco product. Hello? So only 70 parties have conducted at least one national mass media campaign. So this is based on the 2017 Empower data. And if you look at that, so between 15 and 17, there has been reduction. So 3% reduction in parties that have actually done the mass media campaign. And other efforts which has been done, so before the FCTC and even after coming FCTC, we see that there's a Surgeon General report specifically on SLT. There's an NCI monograph specifically on SLT. There has been expert group consultation on smokeless tobacco. And there's been 17 editions of World Conference on Tobacco or Health, and I think experts globally share information on smokeless tobacco during the WCTO election. The last one was in Cape Town. And however, the country level effort has been little limited, and that is limited to Southeast Asia region. So what we see is mass media intervention. One of the best one with respect to SLT is in India, and how the consistent campaign on smokeless tobacco has been done by Government of India, with support from civil society like Vital Strategies, and this has resulted in terms of motivation among people who has been using smokeless tobacco. And if you see that the change is there, and you see that till 2009 and the pictorial warnings that has been changed, and the mass media campaigns has been aligned with these pictorial warnings, and there's a change in SLT prevalence, as well as people who wish to quit tobacco use, or who thought that they will quit tobacco use on because of the pictorial warning. So large pictorial warnings have helped, and mass media campaigns have helped. These campaigns have also been evaluated in India, and they have shown that these are effective. Similar campaigns have also been done in Bangladesh. Public service campaigns have been done on smokeless tobacco. These have been also done in Nepal, Bangladesh, and recently there was a testimonial campaign on areca nut or betel chewing and smokeless tobacco, which is combined, and this has also been, I think, if evaluated, will be in terms of come up with effectiveness of these methods. Another way of creating mass awareness is the earned media. So if we look at the work that we do, even at the Knowledge Hub or at your universities or your institutions, so if once you share these with media, you get a lot of media attention to these efforts, and if you're doing it on smokeless tobacco, so you will get those back, and without spending money on media coverage, which is costly. So if you see that India, Bangladesh, Thailand, they have received widespread earned media on their GATS report, which is releasing of the GATS report. And in India, a small state of Himachal Pradesh, this analysis evaluation was done, and we see that 23% of news focused on smokeless tobacco. And if you look at the overall cost, which was these hypothetical cost is enormous, up to USD 1.5 million. So again, the school-based programs, as Professor Saman also spoke about, they are very effective, and they provide education awareness to students. And there has been effective program by Hriday in New Delhi. The Maitri program is a tested program, and you see that there's a reduction in tobacco use among youths. The Bihar school teachers study has also seen that the rate of quitting has 50% in intervention, while control was really low. And while since school programs are effective, we see that the National Tobacco Control Program of India has included school health program under its ambit. So, while informing and collecting data about smokeless tobacco, let us see, the dangers of the smoking versus dangers of the smokeless tobacco use. So, what we see is that Global Youth Tobacco Survey, the question or what information we have is that 60% of students reported having been taught in school about the dangers of the smoking tobacco in their school. But the same information is not available for smokeless tobacco products, and this, I think, is the need of the hour. While we are doing that surveys in countries, they should also include smokeless tobacco. So tobacco use prevention in school curriculum, we see that this is also really low, and in the global school personnel survey, we find that 64% of school personnel reported that there is tobacco use prevention included in school curriculum. However, 37% of school personnel from the reporting countries indicated that non-classroom programs or activities are used. So these numbers, in terms of, there's a lot of room where tobacco control or smokeless tobacco control could be included in a school curriculum and co-curricular non-school activities in these schools. Going further from the students to the teachers, the surveys further show that the teachers largely lack training specific to smokeless tobacco or tobacco control. So they have said that they do not have access to teaching and learning materials, as only 46% of school personnel from 32 reporting parties reported having access to teaching. So we don't have this reported for 54%, and the parties reporting are also just 32. So out of 182 parties, we find 32 parties reporting this. So teachers do not receive training on youth tobacco use prevention, so that also is alarming. Education and awareness through health warnings. Health warnings on tobacco product packages, as I in my previous slide shown that the Indian warning, with the increase in size and the increase in the content or the warning, the more stronger the warning, the more people are motivated to quit, and which is not there for smokeless tobacco in several parties. Even high burden parties, smokeless tobacco, high burden parties do not mandate pictorial warnings on smokeless tobacco. If you talk about GATS data further, so only India is the party that had this question where they asked that if there was any anti-smokeless tobacco information in any channel. While this information is not collected by other parties, I think this will also make sure that the effort which is being done by other parties like Bangladesh, Nepal, Myanmar, Sri Lanka, where anti-smokeless tobacco campaigns are being run, so those could be recorded, because if you're not asking this question, these information are not coming and will not be available for people to see that what impact these are making. So in summary, what we are seeing is that most of the high burden parties do not have pictorial health warning on the smokeless tobacco products, which is first source of information for any SLT user. Existing data from various sources suggests that there's absence of dedicated mass media communication strategies to reduce smokeless tobacco use. Older studies on smokeless tobacco, largely from the Southeast Asia region, they suggest that there's urgent need for comprehensive education and communication efforts, especially targeting among women, youth, and the vulnerable population group. And I think there is need of national education, awareness, and communication programs which are focused on smokeless tobacco. Key recommendations from the analysis and the progress that we have seen, that the communication program should be more strategic, participatory, and should seek to understand target audiences, addressing their needs and motivation to quit SLT. Parties should consider implementing a dedicated national mass media campaign, including social media, focus on reducing smokeless tobacco use. Parties should also ensure that SLT products are not sold without pictorial warnings, and parties should start reporting the status of SLT use on various indicators of education, training, communication, and awareness under the FCTC reporting instruments like GYTS, GSPS, and GATS. Once we start reporting and implementing comprehensive strategies, we believe that smokeless tobacco use will reduce. Because we were talking about education and awareness, I think to highlight the problem is about 140 parties or 140 countries. The data that is available, published data suggests that 140 countries have more than 350 million people using smokeless tobacco globally. Almost 360 million, and the number of deaths is nearing in terms of more than 600,000, so 650,000. More than 650,000 people die because of SLT use, and the highest burden is in India because the 65% of the problem is in India. So, and the larger part of the problem is in Southeast Asia region. But I think other parties, other countries, and the health department should learn from the problem that is there in the Southeast Asia region and take preemptive measures to prevent smokeless tobacco use. Thank you for your attention, and we can have questions for both me and Professor Saman and myself. We'll be happy to answer any questions that the participants have. So you can also send in your question through the chat or raise your hand and we can add you're unmuted to speak. I see Dr. Vinay is there. Would you like to make some comment?
Amit,
Yeah.
can you listen?
Yes, we can hear you, sir.
We have been doing all these young dental professional exam, graduation and education, rather.
Yes, sir.
It works. Only thing, it has been limited to our university, Maharashtra University of Health Sciences.
Right.
I wanted it by Dental Council of India, and I have already written to the President, Dental Council of India. One of my colleagues is already working on it, so it becomes throughout the country. This module really works because it has a structured curriculum and field visits and all our empower strategies and different modalities. And students can apply, young dental professionals can apply their mind to this real problem. Only barrier is the poor motivation to quit. I have seen the addicts are really, hard to give up the habits because only motivation will not work. We need to add pharmacotherapy, strong pharmacotherapy, especially for the smokeless tobacco.
Yes, I think there is need for having in terms of evaluated mechanisms and methods which are which can be used by others also to impart cessation, because that is one area which is lacking again in terms of the smokeless tobacco. There are a lot of science and evidence on smoking products, but on smokeless tobacco it's still lacking. And I think that would be good if your work can be recorded and shared with the wider public and the policymakers. That will be helpful. Anyone have any questions?
Vinay, has the program being adapted for smokeless tobacco, at least sections on smokeless tobacco? Or
Yes,
is it only on cigarette smoking?
No, we have modified it.
Thank you.
Yeah, smokeless tobacco is the main target for our region and India. So we have literally modified, basically Empower and the John Hopkins combination and our own experience, oral submucous fibrosis is the common nowadays. Last week I was in a village, 50 out of 100 have the chewing habits and submucous fibrosis. Very difficult. Erica nut and tobacco has to be tackled together for de-addiction.
Thank you. Are there any others in the...
I don't see any question on the chat box, so I think...
because if we can see examples of any programs that are being run from various organizations or where you are participating from, it will be good as examples.
Yeah.
May I ask a question? In terms of if there are medical or dental practitioners, how you feel your training has been, and what are the gaps in your training which makes it difficult for you to have these skills for intervention in practice? Could anybody explain what practical problems you face when you are talking to patients because of lack of previous education during your undergraduate career?
That question is for Dr. Vinay.
or any other participating, if there are doctors.
Okay, anyone who, yeah, okay. So anyone wants to respond to that question? I think we have 20 people on board. Should I pinpoint and seek response from people who are working in the field?
Yes, let's try that.
I see a couple of colleagues from Vital Strategies. Should I request them to share some of their, in terms of experience? They are doing a lot of work in the region and globally as well. And can I request to unmute and say a few words? Nalin?
Amit, I'm sorry. Can you repeat the question once again, please? I'm so sorry.
Yeah, I think Professor Saman generally asks, experiences of institution in implementing education training programs. But I think Vital Strategies is doing a lot of great work around the world, and especially in, I think, our Southeast Asia region, which is focused on the smokeless tobacco. So if you could share some of your, in terms of thoughts and how you have worked on the smokeless tobacco campaigns in India or maybe in any of the neighboring countries, that would be helpful for the audience to hear.
Amit, I think I'm sorry, but I'm unable to answer this question because I'm not involved in our intervention. So yeah. Hold on, Amit. My colleague Manish want to respond to that question.
Okay. I saw Manish a couple of minutes back, but I think
Hi everybody. Hi Amit.
Hi.
Regarding the experience of campaigns that we've done in the past. So just a second. Yes, some technical. Regarding our experience of doing a smokeless campaign. So Sunita was one campaign wherein it was also a campaign wherein policy was also, a policy ask was also in a way started as far as from a campaign point of view. And unfortunately, Sunita Tomar became the face of the campaign. She was a smokeless tobacco user who died at the age of 28 due to oral cancer. And a short story about, a short intro about her. So when she died, she was a patient of Dr. Pankaj Chaturvedi in Tata Memorial Hospital in Bombay. And when she died, she left a letter with him. And that letter, in a way, was the main talking point of the campaign it became. And so that was one campaign that had a lot of impact as far as India is concerned. So this is a very short update that I have and I can share with the with all the participants and all the members.
Thanks, Manish.
Thank you very much. Yes, I have seen that some of the clips from that campaign when Professor Pankaj Chaturvedi has been speaking at conferences. And it's a very, very strong message and a very effective message. And I think if we can get this to most parts of the region, it will be very helpful, at least as a cinema clip or, where people come to the cinema to watch, if they can be introduced to this clip from that particular message, it will be excellent. Thank you.
Yes, the efforts are actually on to, to actually maximize the reach of this particular Sunita campaign. And we are trying our best to actually spread the campaign and trying it to, to expedite it, or for example, speaking to Ministry of Health about it, and so that it reaches maximum number of people, especially in India, and then probably, the other countries as well.
Thank you.
Dr. Vinay, you wanted to say something?
Anybody in the audience who is a teacher of a university or where we can talk about curricula? university curriculum where we can do something about introducing to the university undergraduate courses, either medical or dental?
Yes, Saman, we can. We have been doing at our university, and importantly, Indian Dental Association is also conducting tobacco cessation clinics and training programs. So, Indian Dental Association and university, under the umbrella of Dental Council of India, which is a parliamentary body, should be able to train the young dental professionals. So that is the only strength we have. Otherwise, there are lots of barriers and weaknesses. Barriers, I have told you, strong addictive potential of areca nut and tobacco together, quite commonly called as mawa or karra. This has become a nuisance, literally the nuisance.
Thank you. Yeah, Dr. Suzanne?
An honor hearing you actually. I had a question for, Dr. Vinay and in general to the audience. Is there some component on areca nut cessation or on this topic in its entirety in the modules which are used in the schools, or is that proposed? Because there are certain regions which are predominantly areca nut consumers more than tobacco. Is that in the pipeline, or has that suggestion been made as yet?
We always talk of areca nut and tobacco cessation. So nowadays, this is really, we don't just focus on tobacco. It is ATA, areca nut, tobacco, and also alcohol for cancer. But for precancerous, especially also because fibrosis and leukoplakias, definitely areca nut and tobacco. And we also explain them initially. This is the causative agents. Without areca nut, so because fibrosis will not be there. So the main equal attention has to be given to areca nut cessation program. Sri Lanka have very good guidelines about the areca nut cessation programs.
Thank you. And if any proper evaluations are needed, the IARC monograph I referred to, the International Association of Research for Cancer, there are 2 volumes in which the evaluation has been published, because if anybody has doubts about the harmful effects of areca nut in particular, you could refer to those monographs where the published evidence is evaluated in a very strong and effective way, showing the evidence that these products, both smokeless tobacco and areca nut, is carcinogenic to humans. So it's very important to refer to those documents. Otherwise, people disbelieve that these are harmful agents. Thank you. Are there any other aspects we have not covered which you were anticipating and would like to raise them? Please.
We have 10 minutes of time. We can talk about it, and
if you are shy to speak, you can put it on the chat, and then we can raise it, because if you put on the chat to KHSLT, it will come up and we can address the questions.
Saman, my experience is that that self-mouth examination is going to work in this scenario, especially in rural population, where there is no literature to teach them. So, self-mouth oral examination concept, which is which was successful by TIFR studies in Kerala also, and in our region, it has worked out. So, by sensitizing population, showing the ill effects of tobacco and alcohol and areca nut, then the outcome was very good, and we have very good sensitivity and specificity of this self-mouth mirror examination, and it has worked. So in rural India, absolutely, I think we need to go through the camps and with the literature in vernacular or in the pictorial warnings. And so this is, I think my attempt will be to go to the rural population, villages, from the colleges with the college team of young dental professionals with the literature and whatever you have shown, the leaflets and our suggestion sort of modules, and basically the they will have to be explained the ill effects of the tobacco. I think we have to concentrate on that, and definitely from the dental education point of view, Dental Council of India should take up this for all the colleges. There are 300 dental colleges, so it should not be. That is our strength also.
Thank you, Vinay. Yes, I didn't bring up the self-mouth examination because that's more focused on early detection of oral cancer and pre-cancer, because we are focusing on tobacco today. Obviously, I mean, that should be incorporated if we're having health camps, because that goes side by side with tobacco education. It's an important aspect for educating the public on oral cancer. I would suggest that if one of the academics could write a journal article to the Indian Dental Journal on what should be on the curriculum of universities on this topic, it will be good as a sort of a master program so that the deans understand the need for incorporating smokeless tobacco and tobacco in their dental curriculum. I think that will be.
Yes, I will share it with this responsibility with Amit, because we'll communicate, and whatever the module we are, we'll modify it, and that should be given to the journal and of course to the higher authorities, all MUHS, universities and councils, Dental Council of India. And if Indian Medical Association, rather than Dental Association, Indian Medical Association is also collaborative, so it is going to be good.
Thank you.
Certainly, sir. I think we can send it from both our institution and from the Knowledge Hub as best practice models if there are in terms of evidences which are available, published evidence. So we look forward to receive that from you, and I think there are no more questions. So should we call it a day, or if there are any questions, we have still some time.
There is one from Aurelia.
We don't have any questions. So, Professor Saman, I think we had a good discussion, and we now know some things that we can also have as a way forward. And once we hear from, get the evidences from Dr. Vinay, and I think we can share it with policymakers in India. And I think the models, if they are tested and evidence-based, we can also share it on the WHO Knowledge Hub website, as well as models, modules for, or maybe to adopt it by other universities and dental colleges can be done. And I think with this, I'll say thank you to Professor Saman for giving his time and taking time from the busy schedule to present this webinar, and for all the participants to join, especially Dr. Vinay, taking time and joining us and sharing his experience in oral health and in terms of to advance SLT control in India. And also colleagues from Vital Strategies, thank you for joining, and people from across India, the NTTL Noida, NTTL Guwahati team, and others who I am not mentioning. And so thank you everyone. It was a pleasure sharing experience with all of you and this nice evening. It's raining outside here, and so we are having, in terms of a nice evening out here in Noida. Thank you, and see you again in the next webinar, which is going to be in October. And that webinar will be on packaging and labeling and advertisement of smokeless tobacco. So Article 11 of the FCTC will be up in the next webinar. Thank you.
Thank you very much, Amit, for organizing this, and also to Ravi. And Vinay, thank you for joining, and everybody, good luck. Thank you.
Thanks.
I should end. It is recorded, right? And meeting for all.
Yes.